As a patient, what is the dumbest thing a doctor has ever recommended that you do? 1. I was 22 and had sudden, sharp pain low in my groin. It was so bad I couldn't stand up straight and could barely walk. I made an emergency appointment with my OB/GYN. After a very brief and cursory exam he told me it was a swollen ovary and it would go away in 2 or 3 months. I went home and told my then husband what the doctor said. He insisted I get a second opinion. I made many calls. Most doctors didn't do second opinions. I finally got one nurse who, in a bored voice, asked, "What are your symptoms?" I explained and she said she'd talk to the doctor and call me back. This was at 11 a.m. one workday. She called back and said he'd see me at 1. I went to his office straight from lunch. That doctor did an exam, then turned to the nurse and said, "She's the one." I asked what he meant. He said that 1 in 1,000 women claiming they had an emergency actually did, and I was that one. Then he asked, "What did you have for lunch?" I responded, "A burger," and he frowned, then said, "You need surgery." I tried to tell him I needed to go back to the office and close out some projects first. He said, "Oh, you're not leaving here." They put me in a wheelchair and rolled me 200 feet across the parking lot to the hospital. I was given time to make 2 phone calls, one to my husband. I had to leave a message with the office admin. This is long before the days of cell phones, and one to my parents, since I couldn't reach my husband. Later, in the recovery room drive, Horowitz explained, I had an ovarian torsion on my right side. That happens when an ovaries, and in my case also the fallopian tube, bent and twisted around the tissue they're connected to. The torsion happened because there was a grapefruit-sized tumor on that ovary. It was benign, thankfully, but he said it was so close to bursting, and probably killing me, that he didn't dare let me go home. My husband returned to the first doctor's office and read him the riot act for almost killing my wife. 2. My daughter spilled a hot bowl of soup onto her legs on a Friday. She was in pain. Looked bad. I took her immediately to the ER. ER doc said it's like a mild sunburn, prescribed some Silvadine cream and Tylenol. Scolded me for suggesting it's serious. Tell her to stop crying, it can't hurt that bad. You sure, doc? She's overreacting. Later that night I call the ER again. Something's not right. Looks bad. It's as mild as it gets, they said. Let the Silvadine work. Don't worry. Monday morning I take her to her regular doc first thing because she's in pain. He flips out. Can't believe I did nothing. Wants to arrange an ambulance to the burn unit in the city 2.5 hours away. They flipped out when she got there. Over 2 weeks in the burn unit until they let her go home. If I didn't have the paper from the ER to prove our story they would have put me in jail for child abuse. She turned out good in the end. We don't go to that local hospital anymore. 3. When I was 14 I had to leave school because my stomach was hurting really bad. Both my parents were working but I called my mom. She told me to go to the doctor's office. When the old guy who was our family doctor saw me and heard my complaint about the pain in my stomach, without even touching me or taking my temperature he told me I was having my period and that is the cause of the pain. I was not having a period and I really did not know what to do, but I went home and lay down on the couch. My grandma came home from the store and took one look at me and took my temperature. It was really high. She heard the story of my trip to the doctor. Without further ado she put me in the car and drove me to the emergency ward at the local hospital. She went in with me and quite loudly demanded I be seen at once. From there it was emergency surgery to remove my appendix. The surgeon told my grandma that another hour or so my appendix would have burst. I refused to go to that doctor again even if he had been our doctor for donkey's years. Good thing I did not really need a doctor for a long while after that. 4. I had a knife stab in one side of my index finger and the tip was protruding through the other side. It was pulled out immediately and I knew it didn't feel right, so went to see a doctor. I told him it was hurting and I was having trouble bending it. He said it looks fine and to keep it clean. I reminded him that it does not feel right and it was stabbed through. He asked me very condescendingly if I wanted a band-aid with a smirk on his face. He applied one and said there you go, then he walked out. About an hour later I felt something sharp. The tendon had been sliced by the knife and snapped going down my finger and into my palm. It required an initial surgery to open my finger and hand to find, feed up to the other end and reattach it, then plenty of stitches. I then needed physio to make sure I kept fluid motion in my finger. A few months later I needed a follow-up surgery to remove scarring from where it was reattached so I could get better motion bending it. Then more stitches and more physio. Thank you for the foo-hash-percenting band-aid and the condescending smile. 5. At 9 months pregnant my water broke at home. Called my OB, told to come in and see her. She examines me, says I'm 4-5 centimeters dilated and to go home and have lunch, take a nap and enjoy the afternoon. This was 4:30 p.m. Are you sure? Shouldn't I head to the hospital now? I feel I should go straight there? I asked. This being my second child I felt uneasy with the advice, but she's the expert. She got defensive and said, "How dare you second guess me? I've delivered hundreds of babies. Are you a doctor? No? Then yes, I'm sure. Go home. I order you to go home. ! You've got lots of time. You're not even having steady contractions." She was still muttering when I left. Honestly, some of these patients, they have no clue. I have no car. I take the bus home. By the time I get home an hour later I'm in active labor. Contractions 2 minutes apart. Blinding pain. Panicked. Incredibly stressed and overwhelmed by the urgency for help. I got a ride to the hospital and almost delivered in the car. Had the baby within minutes of arriving shortly after 6 p.m. A huge and healthy 11-pound boy. Didn't even have time to take my jacket or shoes off. My pants had to be cut open by a nurse. The next time a doctor disregards your inner voice, listen to yourself and not them. You know your body best. Don't worry about upsetting a doctor. You do you. I trusted the experienced, respected, and highly regarded OB. And she is a good doctor, but everyone makes bad judgment calls from time to time. 6. When I was 17, I was taken by ambulance to the ER in the middle of the night. I had woken up screaming in indescribable agony and then fainted. My parents called 911. At the ER, I couldn't stand to do an x-ray because I would literally lose consciousness from the pain. What did the doctor say? You're constipated. He said I could go home, or stay there after taking laxatives and see if I felt better after a BM. I was furious, but I should note that prior to that, both the doctor and EMTs in the ambulance said you're just pregnant. I told the EMT, if this is pregnancy, no woman on earth would go through it. Plus, I wasn't sexually active. So, what was wrong? My ovary had exploded. So, the whole time I had been internally bleeding while this doctor has me waiting on taking a fucking shit. I can't remember the exact cause of this, as I was a teen and they explained it to my parents. All I remember the surgeon saying weeks later was one ovary doesn't preclude you from having kids. They didn't discover I needed emergency surgery until they finally did an internal ultrasound. Needless to say, they had given me nothing for pain. I'll never forget the look on the lady's face who was administering it, right before she ran out of the room in a panic. After an emergency surgery, I was fine, but they'll never forget the indescribable agony I was in when I awoke screaming. It was just out of this world. The surgery uncovered I also had extreme endometriosis, which they did the best to remove. It, thankfully, didn't impact my fertility.